Contraceptive medications contain hormones that work to prevent the woman's body from releasing an egg, preventing the ability for her to get pregnant during a given cycle. Contraceptives come in many varieties. Oral contraceptives, often called the pill, provides differing amounts of estrogen and progesterone during the menstrual cycle based on the type of contraceptive pill taken. Monophasic pills contain a consistent amount of hormone for 21 days of the cycle. Then the woman goes without the pill or takes a blank pill for 7 days, allowing her to have a period. Biphasic pills provide a consistent dose of estrogen but 2 different doses of progesterone in the monthly cycle. This allows the lining of the uterus to develop normally during the menstrual cycle and reduces side effects due to the abrupt changes in hormones that occur in monophasic pills. Triphasic pills contain varying amounts of estrogen and progesterone in 3 different strengths during the cycle. This again is used to decrease the abrupt shift in hormone levels that the other variations of the pill can cause. The mini pill contains only progesterone and is often used in women who are breastfeeding. It is less effective than the other forms of oral contraception. With all oral contraceptive pills, taking them every day at the same time without missing a dose is essential. One missed dose can lead to hormone fluctuations that will allow the woman to release an egg and potentially get pregnant. Other medications, such as antibiotics, can also reduce the effectiveness of oral contraceptives, so alternative methods should be used when on these medications. More recently, there have been other methods of administering medications with similar effects to the contraceptive pills, including transdermal patches, birth control injections, and vaginal rings. These have similar side effects and risks to the pill. However, they may be easier for women to use as they do not have to remember to take a pill every day. Women may also receive a contraceptive implant. This is a small plastic rod that is placed just under the skin in the upper arm. It slowly releases hormones that work to prevent pregnancy. An IUD, or intrauterine device, is inserted through the cervix and into the uterus. It is good for 5 to 10 years, depending on the device. These work a little different than the contraceptive pills. These agitate the uterus, making it difficult for an egg to implant. The Mirena also contains progesterone, which has a similar effect to the contraceptive pills. A copper IUD does not contain any hormone, but the copper is naturally toxic to sperm. All hormone contraceptives carry an increased risk of blood clots. They should be used in caution with women over 35 who smoke due to an increased risk of clotting for nicotine or are otherwise at risk for developing blood clots. In the case that contraception fails or intercourse occurs without contraception, there are additional medical options that may be considered. Postcoital high-dose estrogen, also known as Plan B, can be taken within 5 days of intercourse. It contains high-dose estrogen and can prevent a fertilized egg from implanting, preventing pregnancy. This is available over the counter in many states, but must be requested directly from the pharmacist. Mifeprex, or the abortion pill, can be used up to 7 weeks since the last menstrual period. It completely blocks progesterone in order to force a miscarriage. If pregnancy is not terminated within 3 days, it may need to be repeated. There are many who have significant moral objections to Plan B and the abortion pill, both healthcare providers and patients. This should be kept in mind when considering these options.